how do we handle class 6 advanced stage baldness with the one go? Because not only doing a transplant, it also makes very crucial role of how do we execute it, how do we meticulously plan the design for this patient would always give you best outcome. Kindly watch this video to understand, to get some basic information on someone who has a good donor with advanced baldness. This patient basically aged 29 years, having a class 6 advanced stage of baldness, provided a strong donor. So here the strong donor makes a very crucial part of this procedure, because without having a strong donor we cannot do this procedure. And initially we had planned 2 sessions with a 6-month gap, but having a patient time constraint was a priority. So we also just changed a plan to 2 days procedure, where we supposed to get grafts from the scalp and beard, but fortunately patient doesn't want to get grafts from the beard. So we are limited to extraction from only the scalp in 2 days procedure. That is 2 consecutive days procedure. Scalp graft alone be utilized in this patient. So here the priority is a patient has a time constraint, and our requirement of the grafts were more than 7,000 to 8,000 grafts minimum. But well, in 2 days procedure from the scalp alone we could get only 4,700 grafts. So 4,700 grafts is not a big number for this kind of advanced stage of baldness. Then how do we go about these grafts? So here we made a kind of a meticulous plan, judicious usage of the grafts without prioritizing in few important zones. In the sense, there is no point wasting grafts on non-priority zones like temple angles and peripheral areas. So our focus was more on the frontal area, mid-scalp, and little bit of the crown. This is the main priority we had in our mind to focus with. Otherwise, we're going to waste the grafts on non-priority zones like extreme frontal hairline and temple angles and peripheral areas, which is going to be a disastrous outcome. So we planned such a way that we gave more focus to the frontal hairline, mid-scalp, and tapering effect to the crown, which gave us a very good utilization and a strategic implementation of the plan. So we achieved a best outcome within 6 months. So we can notice an unnoticeable hairline, which is so natural, and density and fullness in the mid-scalp, and reasonably good density in the crown. And also we had a kind of a challenging issue in the crown, because he has 2 swirls. When we have 2 swirls and runs in opposite direction, it's kind of challenging for us to implant angulations in the same pattern, because if you don't do that way, it doesn't match to his existing hair. And because this kind of angulation orientation, when with someone has again 2 swirls, double swirls, is really difficult. It's kind of challenging for surgeons. What are the density you're going to get? Still appears to be a little less density in the crown area. Well, so we had a limited grafts in this patient because of many constraints. With the limited grafts, we achieved the best outcome. So that is possible with the only strategic plan. That importantly, we did not waste grafts in the frontal hairline much. So we did not waste most of the grafts in the peripheral area, parietal areas, and in the crown area. So focus was only the priority area, front, mid, scalp, and crown. With that, we achieved the best outcome. And well, because of its strong donor also, this plan was possible. Otherwise, probably this patient should always come for second session after 6 months or later. So guys, not only doing hair transplantation, it's most important to understand how wisely we're going to use your grafts, which area, and strategic plan would definitely get your natural looking results. Thank you.